Hi there, my name is David Wallace,
And I'm Ruj Khalik.
and this is Caring for Low-Income Gender Diverse Patients in the Midwest. So according to the 2014 Behavioral and Risk Data Analysis, US transgender and gender diverse patients are more likely to live below the poverty line and more likely to live in rural settings. Inaccessibility to gender-affirming care is recognized as the most significant barrier in receiving this type of care. This is exacerbated in rural communities and for those who are low income. Gender affirming hormone therapy is a mainstay of care, but gaps in knowledge are prevalent. These gaps include those living in Midwestern populations, underinsured populations, and low income populations. And while we might understand the acute physiological effects of hormone replacement therapy, there's conflicting data on the changes in psychological parameters as well as quality of life. As a result, we seek to understand the role of gender affirming hormone therapy in caring for low income transgender TGD individuals living in Kansas and Missouri. We hope to broaden our understanding of this unique population and to examine the role of this therapy in their medical transition within the context of a safety net clinic. Specifically, our goals are to explore the impact of free gender affirming care clinics and addressing community needs, to address gaps in medical literature regarding low income, underinsured, and Midwestern TGD individuals, and to measure GHE's influence on the quality of life, psychological burden, and functioning and experiences of gender dysphoria of TG individuals. So some background on Gender Affirming Night. It is a specialty clinic operated through JDoc Free Clinic. It's a safety net clinic offering free transgender care for low income and underinsured patients. We provide gender affirming hormone therapy through the administration of exogenous sex hormones, and we are the only student run free clinic dedicated to gender affirming medicine in the nation. So as you can see, we have in 2021, we had a total of 94 patients, and in 2022, we had a total of 127 patients. When we look at the distribution geographically of these patients, we see that 41 are from Kansas, 22 are from Missouri, and one's from Nebraska. Of the counties with the highest prevalence of TGD individuals that come to the clinic, Jackson County, Johnson County, Wyandotte County, Shawnee County, and Douglas County had the most patients. When we look at the actual demographics of the patients that we see between 2021 and 2022, we see that the main age is 25. The percentage of these patients that were uninsured was about 63%, and the prevalence of the psychiatric disorders were about 48%, or about half. With that, we see that depression and anxiety are the most prevalent within these. So the demographic data that was presented on the last slide came from the JDoc Free Clinic GAN Red Cap application. The surveys were administered for the quality of life arm of the study in clinic itself. This included the WHO Quality of Life Breath, GAD-7, PHQ-9, and the Gender Preoccupation and Stability Questionnaire. They were given to patients and then grouped into 3 categories based on the time post-HRT: 0 months, 1 to 6 months, and 7 to 12 months. And then responses from the same participants were used to compare rate variation across a patient's transition.
So to look at our preliminary findings, we really noticed significant decreases in patients' experiences of gender preoccupation, significant decrease in anxiety, more so than depression, and a perceived increase in quality of life, and a significant increase specifically in the social component of WHOBREF. We do note that our sample size is relatively small because our population that we're looking at is already pretty small, and we really hope to continue this study and gather more data. But since we're using these validated measures and the GPSQ, which we hope will become a more validated measure in the community soon, we find that these results show that having this hormone therapy and care is really allowing patients to socially transition in a way that brings them more peace of mind and helps with their comorbid psychiatric diagnoses as well. So for future directions, we really wanted to provide insight into why what we do matters. And in a time where transgender and gender diverse healthcare is being threatened across the United States, this care is more important than ever. And we really want to honor our patients and the experiences that they go through and really hammer home that healing and medicine are an art form and that we're really practicing this at JDoc Free Clinic, specifically at Gender Affirming Night. And we hope that supporting and caring for our patients, both in a medical setting and through our other projects, such as our clothes closet, which will also be featured at this conference, we can really care for our patients in a holistic way, and we can help everybody appreciate what gender affirming care can really do. So thank you so much.